I've been in practice almost 30 years and I've never seen this type of tumor in this location.
He had a CT scan that showed a tumor in front of his heart that was actually invading his heart, a football-sized tumor. So, when the pathologists got back to us and they felt it was a primary liposarcoma, meaning it had started in the chest and then invaded into the heart. These represent about 1% of cancers of the heart, so it's pretty rare.
How could it be possible that I can have something growing that could be pressing against my heart? I was scared beyond belief. From the time we had the surgery planned till several weeks after that, because I was in intensive care, is a blur to me. I thought I was gonna die.
It was very tough when we said, yes, we want to do this, when we found the doctor who would actually take something on like this, because there were many that said no.
So the tumor was invading the pulmonary valve and the pulmonary artery as well, which come immediately off of the right heart. So once we had removed the entire tumor, which was about 10 centimeters by 12 centimeters, we were then faced with having to reconstruct the heart in a way that he could live a normal life. To see him up and moving around and spending time with his children and grandchildren is really rewarding.
They got me a new life. They basically saved my life.